And we are here with Dr. Armitage from the Oklahoma Blood Institute to talk about a couple of things. First of all, donating blood is in high demand right now. It's in high need right now. So we'll talk to him about that. And also a new procedure that has been promising, and that is taking plasma from a patient that has had COVID-19, that no longer has COVID-19, and using that in a patient that currently is undergoing some symptoms. So, doctor, explain that better than I did. It is a new way to utilize a procedure that has been going on for many, many years. So the procedure itself is very familiar to you, but now we're using that to hopefully help patients that are undergoing COVID-19 symptoms now.
Yeah, plasma collection, as you mentioned, has been around for a long time. It's a routine procedure. The difference here is we're asking a set of patients who've recovered to come in and specifically give to someone who's sick, probably in the ICU, probably on a ventilator. This is kind of a not a routine treatment. It's for folks who are in severe need of help to get over their affliction with the virus. So the procedure is old, the use is very new. And while we wait on better treatments, hopefully we'll get some antiviral pills. We might get some other therapies that can help cure folks quicker when they get COVID-19, maybe not let the disease progress as far. But right now we don't have those. And this is kind of a stopgap. It's old school. It's been around for probably 100 years or more, in taking somebody's immune system strength and passively transfusing some of the antibodies, the immune proteins that target the virus, giving those to somebody who needs them, and hopefully getting a response, a boost that helps that person turn the corner and recover mostly on their own at that point. You just give them that little patch over to get their own immune system able to fight off the virus. So that's what the procedure's about. It's you have to be qualified as a regular donor because this is a regular blood product. And in fact, the FDA was very good about streamlining the procedures. Even though this is experimental, they don't have the final data that makes them confident that this is worthy of being called an official FDA treatment. But they wanted to get the national trial going really quickly. So they streamlined the rules, made this just like a regular donation with a couple of extra qualifications for the donor. We have to know that you had COVID-19 through a documented test back when you were sick with it. So you were diagnosed by a doctor with an official test result. And then there are a couple of other things we do for folks who aren't maybe 28 days out from their last symptom. We can do a nasal swab, which proves that the virus is no longer present in the body. The immune system is essentially fully kicked in and neutralized the virus. So that's an extra qualification step that we would add. But beyond that, it's just like a regular blood donation. And hopefully folks can feel very comfortable when they come in and save a life in a unique way. I like to say, the virus is being pretty harsh on humans, but this is a way that humans can use the strength of not only their brains to figure things out in terms of a cure, but also their good heart and generosity. That's one of the signatures of our species, I think. And we're using that strength here to fight off this virus and help people who are really sick.
So this is not a cure then, right? This is just sort of helping them get better.
It's a treatment.
It's a treatment, right?
It's a treatment. It's a patch to get their own immune system kicked back, because ultimately you have to fight this virus off yourself. You have to crush it, throughout your entire system. This patch really gets you a chance to get the worst of the attack muted for a little while, and then your own immune system takes over. And really, that's where victory is. You fight it off yourself. But
I see.
It's a patch, a treatment.
So just to not be confused, this isn't a vaccine. A vaccine would help prevent getting it in the first place.
Absolutely right.
We're all looking for that vaccine, the end of the rainbow.
Yeah, this is almost like borrowing the strength of a vaccine. A vaccine allows your own immune system to see a bad virus without getting infected, but your immune system kicks up a response and you're ready for it when it shows up in reality. This is basically taking somebody who kicked up an immune system response in reality and borrowing that strength without you ever having had a vaccination or pre-exposure. Actually, you're struggling to fight off your exposure to the initial insult.
Okay, so if somebody wanted more information about this, perhaps they know somebody that has symptoms of COVID-19 and they really want more information, where can they go?
The best place, if they've got somebody who might be qualified to give this plasma, would be to go to obi.org, and there's a link there to our COVID registry. Or for those who are ambitious, you can go to my.bio-linked.org and go directly to the registry. Either way, you'll be asked a few questions about when did you have your symptoms, what tests were taken to diagnose it, and then we'll call you back and try and get you qualified as a donor. We're collecting in Tulsa, Oklahoma City. We're getting some donors in Little Rock. So it's a big team activity. We're going to pass over 100 products collected and given to patients by the end of this week. So, which is pretty remarkable considering we didn't even have this 2 weeks ago as an option. And now we're up to 100. We definitely want to get up to the place where we've got a stockpile on the shelf. Right now, whenever we collect a unit, it goes flying right out the door to somebody who's waiting for it. The doctors are calling us saying, hey, I've got a patient. We want this to be like the regular blood supply, which is you don't think about it. It's always there for you. There's a planning that goes ahead. There's a stockpile. There's inventory on the shelf. We don't have that yet. We know we'll have hit success when we can look at the end of a day and say, oh, there are 10 units on the shelf for tomorrow, or there are 20 units on the shelf for tomorrow. Right now, we have 0 units on the shelf, and anything we collect the next day is already being claimed, which means it's an important way to help. It's in huge demand. Doctors really, really want this, but for us, it means we need to find more donors. We need more folks stepping up to help us so that we can get ahead of this and not be reacting, not be behind a half step. We'd rather be ahead 2 steps.
Let's talk about donating blood right now. I want to donate blood, so just to let everybody know, because we've heard over and over again to not leave your house, right? Safer at home, stay at home. There's all these phrases out there. This is the one thing you can do. You can leave your house. In fact, it's encouraged to leave your house to go and donate blood, right?
Yeah, this is about the safest place I can imagine that you can be around other humans and other people and have social contact. And these are all great people. As you know, they're donors. They've got great hearts. But even going to the grocery store, you don't have the same kind of pre-screening. All our donors know the first question we ask is, are you feeling well today? They're trained to know that if they're not feeling up to snuff, they don't show up because we won't take their blood that day. We'll ask them to come back later. So the population that comes and gives is probably the safest you could hope for. And then when you get there, we're going to take your temperature. We're going to all be wearing masks. We'll offer you a mask if you come to our fixed sites. Please bring your own if that's the way you want to manage your handling of the virus. But once you get there, we're doing extra cleaning. We've separated our operations so there's more social distancing. The beds are further apart. The chairs in the canteen are further apart. So we're doing everything we can to follow the guidelines and to make it as safe as possible for everyone who shows up. And then the nice thing is I was at a blood drive this weekend. Everybody got a chance to see each other. It's kind of a socially acceptable way to get out and reconnect with folks, see how they look without their hair being done for a little while. That was a big topic of conversation. A lot of guys were getting razzed about their home hairdos. I got to say that. Made me scared to try mine. But anyway, so I think it's just a great place. Another thing I noticed, people lingered in the canteen. Usually folks are so busy, they hop right out of the canteen, they get their Nutter Butters, they're on the move. This time people were really spending time catching up, which felt great. It's a wonderful thing to help somebody else, and it's a great thing to do it as a team sport.
Okay, so quickly explain who can donate. Age, of course, either gender, but what if you recently were sick? Are you still able to come in? Yeah,
If you are
and
feeling
you were
healthy,
and your doctor told you you don't
yeah.
have COVID. You're just sick.
Right. The COVID recommendations are 14 days, feeling better. If you're over COVID, we want you on the registry. So please get in touch with us beforehand and we'll work all that out to maximize your gift. But if you're feeling well, there's, no requirements for, feeling well on the day. Obviously, we want you to be over age 16 and need parental permission in that circumstance. Over 17, you can give on your own. We want folks who are feeling well. They don't have a lot of heart condition is one thing that keeps people from giving. But if you've got high cholesterol, you can give. If you've got high blood pressure, you can give. If you've got diabetes, you can give. A lot of people have misconceptions. Almost everybody can give when we go and look at their medical records and talk to them.
Okay. I know some people have questions about getting a tattoo, or I recently got a piercing. There
Yeah,
haven't been any of those places open for a while anyway, but still answer that question.
yeah, I thank you for setting me up for that because I missed it. The FDA has actually changed all those rules to try and get more donors in and to
Oh,
help.
good.
Usually it's a year after a tattoo, it's a year after you travel out to a malarial risk area, maybe South America or Africa, that sort of place. The FDA said all that's down to 3 months, down from a year not being able to do it to only 3 months. So a tattoo back in 2019, you're good. We're already 3 months up from that.
Okay.
Travel, anywhere essentially back in 2019, you're good. So that's been really helpful that those rules have changed.
And I know that you get a lot of blood donated through blood drives at schools. And since school has been closed, universities, everything,
Yeah.
it has got to be a real challenge for Oklahoma Blood Institute to get those blood reserves, right?
Absolutely. We had a wonderful group of folks who gave back in mid-March. They heard about the issues in the healthcare field. We got a wonderful outpouring of blood, but slowly the tap turned off, as you mentioned, businesses, schools. And what's troubling for us is we can't get back on the calendar. Usually we like to
Right.
have blood drives scheduled out 2 months. That allows us to plan well for those. But right now, all the places are closed. The businesses, and when they get back to business, probably the first thing they're thinking of is not hosting a charitable event, a blood drive. They're talking about getting their business back going. So we've got, I like to call it a tsunami. We've been okay right now because blood demand is down. We don't have as many elective surgeries, although they're starting back on Friday, but we've had several weeks without hip surgeries and a lot of diagnostic surgeries producing, say, more blood need. But so we've been in a lull. We've been down about 30% in demand, but we're expecting that to kick back up. And
Mhm.
now we don't have a calendar that's full of blood drives. So it's a little bit like a tsunami. We've kind of been walking out in the sand flats
Mhm.
because the demand's been low. We're like, where's the water gone? Where's the blood need gone? But it's all been building to come crashing back because we think that once people get back moving around again, once those elective surgeries turn on, I know a lot of
Mhm.
surgeons who are I won't say itching, but they want to practice their craft. They've
Sure.
been out of the operating room for weeks and weeks. They want to get back and heal their patients. So I would imagine ORs are going to be humming when they open for probably weeks. And we
Mhm.
want to make sure that nobody can't get that people can get their surgeries and that blood is not a reason they cannot get the surgery they need, the treatment they need, the relief maybe from the pain they're suffering that they need. So we need donors to come and help us not be a bottleneck. Help us handle the tsunami. Get us up on high ground. Take us
Yeah.
out walking around on the beach looking at shells and get us up a mountain here.
So, doctor, are you able to take like your mobile blood donation unit, the bus that I've given blood on numerous times? Is that out and circulating around? Are you able to, like, if there is a business that wanted to have that, are they
Yeah,
able to
absolutely. We're
schedule?
going out. What we've done is we've spread out the donors. We don't put as many people on the bus to try and do the social distancing. If you've been on the bus, those things were designed to get lots of donors in the beds, and
Yeah,
so we've
it's tight.
yeah, it's tight. So we've changed that. We only have the two donors going on the beds
Oh,
at
I
either end
see.
of the bus. And so it's maybe a little bit more paced, I would say. But yes, we're taking the blood drives out. If you think your business might want to help us, we would love to have the support, show the flag, as it were. Reminds me a little bit of after 9/11, when
Hmm.
everybody wanted to respond and get America, in the fight at that time against the enemies that were attacking our country physically, violently. But this is sort of the same thing. I think America wants to get back to being the great America we all miss. And
Yes.
I think this is just a one step of showing that patriotism and saying America is about not only getting back to business, America is about taking care of its sick. And remembering as you get back to work, oh, yeah, I can go give blood now at X organization or with X maybe shopping center or whatever it is.
Mhm.
Remember those who are still struggling when everybody else gets to unleash a bit.
Some of the latest numbers that I'm looking at now, this, of course, this interview is April 21st. There are 2,807 um, positive COVID-19 cases in Oklahoma, and sadly, 164 deaths. So the procedure we talked about earlier, does that procedure benefit Oklahomans? I know when you donate blood with Oklahoma Blood Institute, it stays here, right?
Right. No, absolutely. We pride ourselves. We're actually getting some contacts from some hospitals that we don't normally serve because we really have focused on the local. There's a big national initiative going
Mhm.
with the Defense Department, and that's great too. Every patient that's cured is wonderful, but
Yes, for sure.
we know that a lot of the doctors who talk to us are very concerned. They know the patients who've recovered, and we're talking to them about recruiting those folks in, but they're very locally focused. Most doctors who have an ICU, they want to help New York and Los Angeles, but they want to help home first. And that's
Mhm.
really been the kind of the intensity around this. Is these doctors are getting committed to helping us in the supply chain. I get you a donor, you're going to send me that plasma, and it's wonderful to be able to answer
Oh,
yes.
yes.
This is right now this is a local phenomenon. When we get extra, like always, Oklahomans share. But let's do the home cooking first. Let's take care of those folks who are, maybe they're in St. Francis, they're ill, maybe they're in Hillcrest South. We want to help those folks get out of and I don't know, those are just names I'm throwing out. I have no information on any
Uh-huh.
patients
Yeah.
anywhere, but locally we want to make sure that a neighbor gets help, a friend, a coworker gets help, and then we'll do the other stuff.
Doctor, thank you for spending your time with us. I'm sure you're very busy. And again, for anyone watching this, I am going to be donating blood at Oklahoma Blood Institute
Woo!
very soon. I'm going to be posting it on social media, and I want to encourage everyone and also remind everyone that this is something you are allowed to do. We all want to go out and see movies. We all want to go to dinner. We all want to go to concerts and all that fun stuff and catch some sports. But we'll have to wait to do those things. But this is that one thing you can do. So, Doctor, we will see you very soon, so I can do that. And please keep in touch with us here at iHeartRadio.
Awesome. Thank you for all your support. You guys are amazing. Thank you.
Thank you.